Thank you. Respected audience, the president of the conference, Dr. Sara Salman Zaberi, is a medical graduate and currently working with World Health Organization (SIN). Along with her job, married life, and social activities, Dr. Sara earned her double master's degree in public administration (MPA) from University of Karachi and in public health (MPH) from Buckeye University, Karachi, with distinction and gold medal. Dr. Sara Salman has more than a decade experience working in public health field from implementation to operations and planning, focused on reproductive, maternal, neonatal, and child health care. She has been associated with national and international NGOs in Pakistan. I would like to invite Dr. Sara Salman to please address the gathering.
Thank you all. Respected Sadia Rashid Sahiba, President, Hamdard Foundation, Honorable Dr. Javed Ikram Sahab, Minister of Health, Government of Punjab, Her Excellency Dr. Azra Fazal Pecheho Sahiba, Minister of Health, Sindh, Dr. Jamshed, Head of Office WHO Sindh, WHO Punjab, my fellows, principal, teachers, delegates, Assalamu alaikum. On behalf of our Regional Director, Dr. Ahmed Al-Mandhari, and representative of Pakistan, Dr. Palitha Mahipala, I congratulate the Hamdard Foundation and grateful to Mrs. Sadia Rashid, the president of Hamdard Foundation, for coming together with WHO to celebrate the World Health Day today and every year. We are also very much thankful to Hamdard Foundation for holding the International Children's Health Conference annually to mark World Health Day and WHO's anniversary. We appreciate the meaningful engagement of delegates from Pakistan and across the globe in the 31st International Children's Health Conference, which come around the time each year of World Health Day. WHO is thankful for the Hamdard Foundation Pakistan and Hamdard Public School for your timeless efforts for raising the voices of children and engaging the young generation in the matters of health and well-being. WHO is committed to support Hamdard Foundation initiative of International Children's Health Conference every year, as it is an excellent opportunity for children to showcase their vision for the year's theme, Health for All. In 1948, countries of the world came together and founded WHO to promote health, keep the world safe, and serve the vulnerable, so everyone, everywhere can attain the highest level of health and well-being. In addition to focusing on journey to achieving health for all, which is the year's theme, WHO is observing its 75th anniversary, and also Hamdard Foundation and Pakistan is also observing the 75th anniversary. It's a moment of pride for all of us. Under the theme of 5 years of improving public health. Health for All envisions that all people have good health for a fulfilling life in a peaceful, prosperous, and sustainable world. The right of health is a basic human right. Everyone must have access to health services they need, when and where they need them, without financial hardship. 30% of global population is not able to access essential health services. To make health for all a reality, we need individuals and communities who have access to high quality health services so that they can take care of their own health and that of their families. Skilled health workers providing quality, people-centered, and policy makers committed to investing in universal health coverage. Almost 2 billion people faced catastrophic or improvising health spending with significant inequalities affecting those in the most vulnerable settings. Universal health coverage offers financial protection and access to quality essential services, lifts people out of poverty, promote the well-being of families and communities, protects against public health crisis, and moves us towards health for all. WHO is supporting the provincial government for the implementation of universal health coverage in across Pakistan, and also in Sindh, we are moving towards universal health coverage. On this anniversary, the Director General, Dr. Tedros, said, this milestone is a very important one, as it reflects WHO longevity and sustainability in serving the people of the world by promoting and protecting health for all. It is testament to the excellence and commitment of thousands of individuals from all backgrounds who have come together across its history as member of the World Health Organization. I congratulate all delegates from presenting their impressive thoughts and Hamdard Foundation for holding a successful international conference. I once again thank you all for having me today, and from the behalf of World Health Organization, all three tiers, headquarter level, Dr. Tedros, from the Eastern Mediterranean region, our RD, Dr. Ahmed Al-Mandari, and WHO representative Pakistan, Dr. Palitha Mahipala. Once again, thank you, Ma'am Sadia Rashid, the president of Hamdard Foundation Public School, and for Pakistan, and all the schools who are just joined us from other provinces. The Hamdard Foundation branches from all over Pakistan, are delegates from across globe for today's conference along with WHO to celebrate the World Health Day 2023. I thank you.
Thank you, ma'am. I would now request Dr. Khalid Naseem, Administrator, Hamdard Public School and Hamdard Village School, Karachi, to give vote of thanks.
Bismillahir Rahmanir Rahim. In the name of Allah, the Beneficent and the Merciful. This is the third year in succession we are having this virtual International Children's Health Conference on World Health Organization's World Health Day. The rigid lockdown of 2020 is no longer there, but with the end of Ramadan this year in end of March and followed by the month of April, and with participants not only from Pakistan, but from countries located at different time zones around the world, the management of Hamdard thought it better to have this live streaming event instead of a large gathering of guests and students. The day's proceedings started with recitation of the Holy Qur'an, verses from the Holy Qur'an. This was followed by the opening speech of Mrs. Sadia Rashid, President of Hamdard Foundation Pakistan. I would like to thank her for her unrelenting support to us in arranging this program regularly. Thereafter, the Pakistani and foreign youth delegates impressed us with their speeches on the topic Health for All. They spoke in English and the national language Urdu. The foreign delegates were from Canada, USA, Afghanistan, Iraq, and the United Arab Emirates. The Pakistani delegates were from Karachi, Lahore, Peshawar, Quetta, Rawalpindi, and Islamabad. To all these delegates, a very big thank you. Today's guests of honor were Dr. Jamshed, Head of World Health Organization, Punjab, and Dr. Javed Akram, Minister of Health, Government of Punjab. We had the privilege to hear both of them. Thank you, sir. Then we heard the president of the conference, Dr. Sara Salman Zuberi, head of World Health Organization Sub-Office, Sindh. She deserves special thanks for being present throughout the program. Madam, we are extremely grateful to you. Then our special thanks also go to Her Excellency Dr. Ashraf Fazal Bechuho, the Minister of Health and Population Welfare, Government of Sindh, for acting as today's chief guest. And before I begin to thank people, let me just inform you that at the back end we had a bunch of people, especially led by Sayyid Muhammad Arsalan and Dr. Sana Gauri, both of Hamdard Foundation Pakistan. Also, there were others from Hamdard Public School, Mrs. Maria Akbar, the senior headmistress, Mrs. Farhiya Raza, headmistress of the primary section, Mrs. Nabila Maheen, headmistress of middle section, Hamdard Public School, and then Mr. Salim Jatoi, headmaster of Hamdard Village School. They were ably supported by Sayyida Hafsa Rizwan of Hamdard Public School. The heads of Hamdard's offices in Lahore, Rawalpindi, and Peshawar are also to be thanked. Without their input, it would not have been possible to put up this program. The Chief Executive Officer and the Managing Director of Hamdard Laboratories, Mrs. Fatma Munir Ahmad deserves special thanks for encouraging us to participate regularly. Then finally, before ending, I would like to thank, Dr. Tedros Ghebreyesus, Director General, World Health Organization, Dr. Ahmad Salim Manthari, Regional Director, World Health Organization, Dr. Palita Mahipala, World Health Organization, Head of Mission in Pakistan. Finally, our compare, Aayzah Naveed of Hamdard Public School did a fine job. I would also like to thank her. In the end, my sincere gratitude on behalf of Hamdard Foundation and Hamdard Public School to you all for participating in this program, and to Mrs. Sadia Rashid, Dr. Maha Munir Ahmad for staying until the end of the program. Thank you all.
Thank you, Dr. Khalid. No one should put in a condition where either they have to avail the healthcare services or they have to feed their family members. Often the poorest are hardest hit. Those with little income to spare face the higher risk of disease and are plunged further into poverty when paying for healthcare services. We need to fight this global pandemic and require a united and proactive approach. If we are divided, we will perish. United, we will survive. It is prudent at this point of time to have a right to access to healthcare across the world. In compliance with the tradition of Hamdard, we end our program with Dua Saeed.
Zidni